The mass itself is about 10 centimeters long. Put on your battle gear and be ready to fight.
We're here to support you in any way that's helpful to you.
Okay, we're going to put you in the scanner in the position to get ready for the scan.
The Kimmel Cancer Center Thoracic Oncology Multidisciplinary Clinic is in session. The day begins with explanations.
Goal number 1 is to kill the cancer. Goal number 1B is to take care of you as a whole person. Even though you may have different problems, you still need the help of the same doctors. And often for these kinds of cancers, you need the help of more than just one doctor. So by coming today, we're able to get all of those doctors together, you meeting them all in the same day, but most important, having the doctors around the table discussing your case as a group and coming up with a team decision on what's the best recommendation for you.
There's a 50% response rate to first-line chemo, so could we try chemo and then hold radiation?
We have found things that you get exposed to in your lifetime that we know cause cancer. The number 1 cause for cancers within the chest, whether it's lung cancer, esophageal, mesothelioma, is typically smoking. There are also things we get exposed to in our lifetime, particularly on the job, that can cause cancer. There's also things we inherit from our family, genetic changes or predispositions in our DNA that can cause cancer, and that's out of your control. There are things in your lifetime that you can do to improve your immune system to fight cancer. My mother always said, eat your green leafy vegetables, and nobody wanted spinach. Now we have scientific proof that there are things in those fruits and vegetables that help your immune system fight off cancer. Getting a good night's sleep, believe it or not, helps your immune system. The way you handle stress, exercise, alcohol in moderation, all of those healthy behaviors that improve your immune system can help it fight off cancer. But for whatever reason, the scales are tipped, you have cancer, and now we have to deal with it. This is the beginning of a long road. This is hard. Hard on your nerves, hard on your relationship, hard on your marriage, hard on your body. But it's doable. You need to give yourself little goals to get through this.
Staging.
I want to be able to explain about cancer, how it forms, how it spreads, what the different tests tell us, what the different treatment options are. So hopefully when you meet with the doctors later, things will make more sense. Cancer cells behave different in 2 major ways. The first way is cancer cells reproduce out of control. The other way cancer cells act differently is they don't respect boundaries. If a muscle cell bumps into a bone, then it grows this way. If a cancer cell bumps into a bone, it just invades right through it. So it's not surprising when we discover a patient has cancer that it could have spread, and particularly these cancers within the chest can be there for a long time before you even have any symptoms to go to a doctor to get any tests done. These cancers spread 3 different ways, and we have a scoring system or a staging system for how it spreads. The first part of that system is T for tumor. The tumor itself just getting bigger and bigger and bumping into what's beside it. And we give it a score, 1, 2, 3, or 4. Most people are at 2, 3, or 4. The second way cancer spreads is through your lymph nodes. You've got lymph nodes everywhere. In my mind, the lymph nodes are the garbage trucks in the neighborhood. So if a lymph node is big and swollen, that's because it's either fighting an infection or it's full of cancer. We also have a scoring system for the lymph nodes. If they're within the lung, those are going to be considered N1. If they're in the center of the chest, N for node, 2. If they're far away, up here in the neck or down in the belly, that would be a 3. The same principle applies for the esophagus. If there's lymph nodes close, they're a 1. If they're farther away, it's a 2. If they're real far away, it's a 3. The third way cancer spreads is if the tumor cells jump off of the tumor and get in the bloodstream. If it gets in the bloodstream and goes to a different part of the body, that is called metastasis.
Diagnostic testing.
One of the first steps you have is an x-ray, and it will tell us, oh, there's something over here that's not quite right. Often that x-ray leads to further testing, and most of you have had a CAT scan done. I want you to picture your body like a loaf of bread, and we're going to start at one end and pick up a slice and take a look at it. And we're working our way down your body, taking cross-section pictures as we go. So then when they look at the pictures and they see something over here that's not quite right, we have more details and more description, and they can tell us about it. Now we have a CAT scan that tells us where the mass is, tells us we've got swollen lymph nodes, but we're still not sure if this is a cancer. We essentially need to get a sample of that in the lab under the microscope to prove it is a cancer, and if so, what kind of cancer. There's several different ways to do biopsies. We have a test that's called a PET scan, PET. If a spot in the liver lights up or a spot in the bone somewhere light up, we would need to be worried that the cancer spread there. If there are spots all over the place, we're not going to go biopsy every one. But we would want to do one more biopsy to prove that it did indeed spread in the bloodstream. Because it makes a big difference how we take care of you. So we have all of these different tests that we put you through so we can figure out exactly the score or the grade of your tumor.
Treatment options.
We talk about treatments. The best chance of a cure is to just cut it out. If surgery can get everything out, surgery is the best chance of a cure. If it has started to spread, then often what we recommend is chemotherapy and radiation first, stop it in its tracks from spreading any further, and do surgery second. So chemo is going to be a combination of 2 drugs. It goes in the bloodstream to kill not just the tumor or the lymph node cancer cells, but hopefully any other ones that happen to be traveling somewhere else. Chemotherapy is normally given in what we call a cycle. So every 21 days would be considered one cycle, and then we repeat the process. You are part of our team, so we know that it causes side effects, but we will try to adjust for that as best as we can and manage those side effects so it's not so disabling. We will give you anti-nausea pills, and let's say you get your drug on Monday. I'll say, take your nausea pills 2 times on Tuesday, 2 times on Wednesday. Come Thursday, you'll probably be fine. Change your diet if you're nauseous. Don't eat anything that's fried or spicy. Be sure you have lots of liquids. Just take it easy for a couple days, okay? Call me if things aren't working. We need your help. If the anti-nausea pill we give you doesn't work, then we try another one, but it's not a walk in the park. When we do radiation, we need to very carefully plan bringing the X-ray beams in from all different angles So we get the maximum amount where it needs to go to cause the right kill effect, but the least amount of collateral damage. What we have learned is if the chemotherapy is in your bloodstream, when the radiation happens, you get a better kill effect. So if we're going to do combined chemoradiation, we're going to delay your chemotherapy to start the same time the radiation starts. Radiation is every day for a total of 5 to 6 weeks. But that's what's required to get you the best kill effect.
Hope and Hopkins Care.
This is hard. And the emotional roller coaster that you ride will change over time. As time goes on, things shift, okay? You get tired of it. You're frustrated. Your relationships with people also change. Right now is hard, so I recommend you're gentle with each other. Be quick to say, I'm sorry. Be quick to give the other person some space. They're not at their best right now. Neither are you. If the people beside you could take this away, they would do it in a heartbeat. And if roles were reversed, you'd be doing it for them. Be gentle. Give time. Most important, talk. They don't know what you're thinking. Let them help you. You're not used to being the one in the family that needs help. Get over it. Let people help you. Understand that anxiety and depression are part of this, but at the same time, we want you to still be able to go through your life while you're getting treatments and still get joy out of your hobbies, out of your friendships, be able to have a nice night out to dinner in the midst of all of this. Let's not let it take control of everything. You're at Johns Hopkins. I probably have an expert for whatever your problem is. Whatever the need is, speak up. If I can't fix it, I'll find somebody who can. Today is the day we come up with a plan for the best chance of a cure. Some people we may not be able to cure, so then we come up with the best treatment plan to get as much time, quality time as possible. Once you're through the initial big treatment for your cancer, we are always going to follow you. Unfortunately, these cancers can come back. So we will follow you after your treatments. And in the beginning, we see you every 3 months with a CAT scan, and then it's every 6 months, then it's once a year, okay? If or when the cancer comes back, it's a whole new ballgame. And who knows what will be discovered by then. And we cross that bridge when we get there. As far as I'm concerned, you need to believe you are in that percentage of people that we cure. Until we do a test and prove otherwise, you are in that subset that got a cure. That's how you have to live.